Live from Village Connection Media. Live from Village Connection Media, we would like to welcome the Greater East-Northport Civic Association.
Of the Greater East-Northport Civic Association. I am Margaret Finelli Granger, Vice President, along with my co-Vice President, Teresa Ford, and we have two important neighborhood leaders with us this evening.
Good evening, everyone. Substance misuse and mental health issues has touched nearly every community and every family in one way or another. But behind every statistic is a face, a name, a grieving heart. And today we are honored to welcome Patty Burke Buckler, a mother who lost her adult son to substance misuse. She's here not only to tell us about her son, the son she loved, but to help us better understand the issues families face and what needs to change to save others in our community. We are also honored to have Executive Director of the Northport East-Northport Community Drug and Alcohol Task Force, Executive Director Linda Oristana. This conversation tonight is about truth, heartbreak, and hope. It's about seeing substance misuse as not as a moral failure, but as a public health crisis that demands our compassion, action, and community. So whether you are a parent tonight, a teacher, a faith leader, a policymaker, or someone who just cares about your neighborhood, I hope you listen closely, because what you hear today could hopefully save a life or help your family or your neighbors in your community. And so for our first question, Swap.
Welcome, ladies. Linda.
Thank you. Thank you. Thank you. It's nice to be here.
So, Patty, can you tell us a little bit about your son, Mark?
Sure, I'd love to. First of all, thank you so much for saying his name.
Of course.
Because it's the one I heard something one time that when you lose someone, you lose them twice. Once when they pass, and then again when people stop saying their name. So thank you very much for saying his name. Mark was a wonderful human being. He was loving, he was compassionate, he was kind. He would give you the shirt off your back. He was active, I guess, as he was young. He was active in the community. He was an altar server. He played sports, even though they were not his favorite. He was involved in local soccer, youth coalition, and things like that. But basically he was like an outdoorsy kid. He didn't really like to, I know I said he played sports, but he really found his passion in just doing things outside, like the fishing. He was fascinated with deer and wildlife. He, your typical boy.
And I always remember him from a young child as well. And I always admired your family and, in church. And he was a big part of the St. Philip Neri community as well. And so we're honored that you're here to share, because obviously it's not easy to talk about. And when we started this podcast and the Greater East-Northport Civic, one of the goals was to educate the community on issues that are important. And I feel like every single family has some kind of, whether the misuse disorders, mental health disorders, problems with alcohol, drugs, etc. So I really admire you for we're all kind of stepping out of our comfort zone a little bit. And I really hope that there is a mother or a father out there listening tonight, or if they see it after the live, that they know that there are people that are willing to help.
So can you give us a little bit of background? When did you realize Mark was struggling with opioids?
Well, I don't want to say like most typical teenagers, but as a teenager, I did start to realize that Mark was using marijuana. I would find little signs of things in his bedroom, and so I immediately wanted to stop that as fast as I could. Fortunately, I worked at and I still do work at Northport High School, and in the counseling center, as a matter of fact. And we were fortunate enough to have a drug and alcohol counselor there. So I immediately went, an assistance counselor. So I immediately went to him and asking, what do I do in this situation? He basically was like, well, you're doing all the right things to try to keep him from progressing. He said, most likely he's just kind of experimenting. But just make sure he knows that you're onto it and not wanting it to progress further. Sadly, he progressed further, and then there was a period of time where he switched to using Xanax, and then before I knew it, I guess it was soon after graduation is when he had progressed to using the stronger drugs, the Percocets and the Vicodins and that kind of thing.
What was the turning point? I know you had mentioned that he started off with marijuana, but what was the turning point that maybe caused him to go to the opioids? Was it the availability in the community? Were they readily available for students able to access the drug?
Right. Well, Mark graduated from high school in 2011, so I think at that time, the opioid epidemic was, really in full swing, and people's medicine cabinets had lots of drugs in them, and we're in a middle class neighborhood here, and the access is there. The families have money. Kids, will often ask for money, and then instead of going to McDonald's or whatever, they're going to purchase whatever it is that they want to, whether it is to have fun or just try something new. But I think that's where that happened. Yet it was very available to people.
Just out of curiosity, do you think it's changed the availability, and has it decreased since, like, as a generalization, or is it still as prevalent?
Well,
We access
Yeah,
drug.
I don't.
Sorry, I should have had that question for Linda, right?
That's okay. I think that the access is still there. The drugs are different. So I think that's what's changed mostly.
So, I just wanted to ask Linda if you could explain to the community what your role is on the Drug and Alcohol Task Force, and how you got involved in the work, with a twofold question to explain to everybody.
So I got involved because I am a person in recovery for many years, 36 years, and I always had a passion for trying to help people that had issues like this. I know what it's like. I started when I was very, very young, and it's really hard. It's a disease of isolation, and I also had family members that had drugs. I had friends that I lost, so there was a lot of motivation to get me involved in something like this. It's really interesting, though, how, I never thought I would be doing this. If you would have told me many years ago I'd be doing this, I would definitely disagree with you, but
Your life you're on a journey.
I am on a journey. I'm on a path, and God has a sense of humor. So, the Drug and Alcohol Task Force is just so amazing because we have such a great team of people that work with us, and our goals is simple. Okay, it's prevention, it's education for youth. Okay, we just don't want anybody to sell or give underage youth drugs. So that's what we do. We do mostly prevention and education.
And then with regard to the task force, and recently the issue of the vape shops in the community. I know that you were spearheading efforts to communicate with the vape shops and implement changes in the community.
Well, I should know. Oh, go ahead.
And I was going to say, I feel like so many people I talk to, everybody's like, the vape shops, the vape shops. Can you give us an update on
Sure.
how long info that?
You know, as you know, there's so many people in the community that are so disheartened by having 9 vape shops in a 3-mile radius on Lockfield. You know, that's a lot of vape shops. And a lot of them would like to see them go out of business, which is not an easy thing to do. So what we decided to do was to partner with the vape shops. And what I mean by partnering is to go in and meet with them and have them come to a meeting and help them to understand, you know, that we want to work with them and that some of their businesses are really, you know, important. These are, you know, the lifeline of their families, but others are not, you know. So what we've done is we've created a kit, an educational kit. And we go into the vape shops, and Chris works with me. He's great. He does our social media, and he helps me with the kits and outreach. And we go into the vape shops, and we talk to them, and we help their employees learn about ID checking, okay, which is really important. The other thing we do is let them know about the laws because, you know, they might not know what the law is, you know, and also about zoning. Zoning's important. You know, and then the other thing we do is we're going to give them a sign to put in their window, okay, that says that they work with us, okay, and they will not sell to underage. It's the underage. Yeah, we don't really care what they do with adults. No, that's not our thing. You know,
Has been receptive to the
very receptive, and we're so pleased that they've been that receptive. You know, I'm sure you've seen recently. I mean, just to let you know, we have a really good team working with us. You know, the town of Huntington is working with us. Suffolk County legislators are working with us. The second precinct is working with us. You know, we have community members working with us. So we have a really good team to try to get this under control. You know, we're powerless over what happens, but we could put the footwork in, right? So we want to make sure that we're doing, you know, what's important for our youth and helping them.
Right.
And as you know, recently, you know, Second Precinct was able to shut down one of the shops.
Right, that's what I was going to ask.
Yes, that was selling
So that was a newer one.
Oasis.
Okay.
And there's
Still closed. Right?
yeah, it's still closed, and I hope it'll stay closed for a long time.
Do you know what I think about the laws regarding that? Like they closed them down.
You know, it was very simple. They were selling drugs.
Oh, it's not true.
Yeah. So, you know, yes. So, you know, and the Second Precinct has been watching them and, you know, and they got them. And we're really happy about that.
And
You
that's
know,
what we need
and-
more enforcement.
Yes.
And that will deter, hopefully, other businesses from doing illegal things and see them shut down. And
Right. Enforcement is key, okay? But it's also challenging. I mean, Suffolk County can also enforce, you know, so there's a lot of different ways to go about it. The one thing I tell people is some of the vape shops were transferring over into convenience shops because we also have challenges with that. But what I did learn is that if your primary product or use is vaping, no matter what you call yourself, you're still a vape shop. So, and you have to keep that license. So that's what's so good about it, you know. But I think we're making positive impact. And I'm really excited about it because this is what our community has asked for.
Right. I see you in the school as very, you know, you're really out in the community, and I do notice there's more conversation, and you brought it really to life, the whole program. I'm sure it's been doing wonderful things for years. I was just going to also segue over to Patty with regard to Mark. When you realized he was doing, I know you went to the school counselor, and you obviously didn't know that it was going to go down the trajectory that it ultimately did. But are there things that you could share with community parents that what you would wish you had known earlier as a parent, or is there something if you had to tell a mother or father out there today, like, you got to know this. This is something you need to know that maybe would have stopped what happened to my son.
Well, I think once I realized that he was dabbling or was using substances, the thing that I did was try to educate myself. So that's how I became involved in the Drug and Alcohol Task Force as well. I started to go to the meetings. I started to get involved in the initiatives that they were putting forth. It was very early on in there. I don't know how many years it's been.
Well, since 2006.
Yeah. And so I got involved, I'm going to say maybe in 2009 or 2010. Um, and so that was one thing that I did to just educate myself and then help spread awareness to other people. Cause there's so many parents that say, well, my kid won't do that, or
Yeah.
that's not going to happen in my family. And I just said, okay, it might not, but just be aware if you see X, Y, or Z.
Yeah.
The signs, whatever those signs may be, isolation, like Linda said, I noticed my son started to retreat from the family and, hole himself up in his room. I started finding emptied out pens, or anything that could be put together to look like a bong or some kind of a pipe. And so I became like borderline obsessive with like going through his room and his social media and things like that. And where some people felt like that was an invasion of privacy, I felt like it was just a way for me to get a good handle on what was happening so that I could, try to prevent the next step.
So maybe the advice could be to invade that privacy, right? Like of your child, we all, as parents, I feel like they close the door and they say, yeah.
Right.
But there is a point that maybe if there are the signs that the parent should move forward, right?
Well, I think the word invade is a little harsh. It's like, I don't know if I'd want to invade somebody's room, especially a child that I want to help, because they may get extremely defensive. I think what's really important is that you don't judge them and that you listen to them and tell them that you love them, and you want to help them.
I think that's the person in recovery, right? Because she's learned after all these years. Those were things that I learned moving forward. I'm sorry to interrupt you, but if I could do something different,
Right.
I would. Linda and I have spoken about this before. I would say, what is it about you that you feel like you need to do this, like change who you are?
Right.
What would Mark say? Like, what would he tell you?
Well,
As he trapped in this,
as the years went on and as we had conversations, he told me he felt like he had a gaping hole inside of him that he just could not fill. And so he was trying anything he could to fill it, whether that be, risky behaviors or getting involved with the drugs and the alcohol. Alcohol wasn't really his thing, but that was, I think, a way he thought he could fill that. And I think at first there might have been something that he was like, oh wow, this feels good because now I'm not nervous. I don't feel uncomfortable. And then they just start to keep chasing that, and it never comes to pass. So
I'm sure initially there has to be, denial on their part. You confront the person and say, I think you have a problem. And they say that, no, everything's fine.
Right.
Right. Sometimes they don't
Yeah, and there's fear,
help.
denial, fear. Those are all,
shame,
remorse, shame,
where they
right?
where they feel shame. And you said early on in the show, this isn't a moral failing by any means, right? It's a disease that needs to be treated with compassion.
Yes.
And
I think I asked you before we were talking when we initially were setting this up. And I feel like a lot of people, like young people, teenagers, families in general, that shame is a big part of addiction. And you made a comment that I thought was really interesting. You said, I'm so past shame. And I was, it was heartbreaking to hear. And it's so true. It's like the shame we're going to feel as human beings, but we have to know how to feel comfortable being uncomfortable or moving on from shame as
So stigma
the stigma.
is what's really key. Okay. And what's behind the stigma is the shame. People are embarrassed. They feel shame.
Feel like they failed.
They feel like they failed. They feel like they didn't do a good job. These are all things that are not their fault. And this is what we're trying to work on is definitely they're afraid to talk. This is what we want to try and overcome is the stigma, because that would help tremendously.
Right. Well, and when I made the comment that I was so past shame, I said it from the family point of view, right? Addiction is a family disease. It's not substance misuse, pardon me, is a family disease. It's not just the person that's struggling that is going through this pain and this shame and this agony. All of the family members are experiencing the same issues because they have so much fear and anxiety. Where is my child? What are they doing? How can I help? And so I did a lot of work with group work. I joined a lot of different support groups.
I saw that you were with the Heron group.
With the Heron Project, yes, they had virtual meetings, so it was not something I could do in the comfort of my own home at a time that was convenient for me. I found a group of people, like-minded people that wanted to, save their loved one.
Right. Was there a turning point for you when you knew that you had to reach out? You had to reach out for counseling for yourself amidst the struggle that he was going through.
Oh, absolutely.
A moment that you knew.
What was the turning point?
Yeah, what was the turn?
Well, I mean, I was at a point where I was literally, I couldn't function. I would decline invitations. I would be at times curled up in the fetal position at home, like just feeling alone, feeling shame,
Fear paralyzes.
yes. And what must people think of me that I can't control my son? And through all the work I did with groups, I realized that that's not, that's it. None of it was my fault. Mark actually even said to me, "Mom, this is not your fault. You gave me everything that I could possibly want or need. It's nothing you or Dad or Sean, his brother, did. It was just a feeling that overcame him that." He said to me one time, it doesn't matter how much I love you or love my family members. I love this drug more. And no matter what and he also said, it's like if he was drowning and he was trying to get his last breath, he would have to go for that drug to get the last breath.
So, what if Mark could get a message through you, like, what would he, like, if you had to think, what would he want to tell the community, the young people, the mothers, the parents, like, in hindsight, like, well, from his life, almost like a theoretical kind of thought, like the message he wants sent.
Well, I don't know if this is politically correct to say, but like he was he did have moments and periods of sobriety.
Right.
And those periods of sobriety were due to his spiritual connection, to his working with a higher power, if you will. And that was when he felt most like himself. And so I think that was the thing that filled the hole for him.
Right.
And without going into a big, long, drawn out story, there was, Mark was present when his grandfather passed.
Right.
And
Into that story.
and he said he felt God transfer from his grandfather into him, and he felt like he was whole. And so that was really very moving for all of us as
Father too. Hattie's father was such a great man in the community as well, and just really involved, and everybody loved him.
so so that was, and Linda had asked me in our conversations, well, what changed that? And I think, yeah, because, relapse is not always a part of recovery, but in many instances it is. And I think it was very evident, even in my conversations with Mark, and even when I would watch what he was doing, once he would get out of his routine of following his quiet time in the morning, his prayer circles, or whatever it was he was doing, those were the times when he would fall back. And
Right. So even with all of the interventions, he was still wanting those drugs over time, right?
when he wasn't following
The protocol. Yeah, it's a protocol program.
How many years would you say he battled from the first time he took drugs to late at?
well, I'm going to say a minimum, like if I say from 18, which it was probably 16, and he passed at 28, so 10 to 12 years.
Yeah, 10 to
Thank
12
you
years.
for sharing all this, because I feel like I still had teenagers, college age, and so does Margaret. And I feel like what you hear quite often are like fentanyl, and I'll tell a lot of my students as well at school, like any drug now, all it needs to be is laced with fentanyl.
Fentanyl is not a drug; it's a poison.
Can you tell us a little bit
That's
more
how,
about
Yeah.
how Mark died.
Yeah, that's how Mark died. Yeah,
Oh, wow.
yeah. So fentanyl is, to me, a poison. It's horrible. The tip of this pen, you take that much fentanyl, you die. And now what's happening is they're lacing fentanyl with different types of drugs, like xylazine, which is an animal tranquilizer. And they cut it in there because it's cheaper and it goes longer. So I always say, yeah, so they'll get high longer, but at the end, it'll kill them.
So
Right, exactly. So
let the
It's laced with cocaine.
yeah,
It's
it's laced in anything you can think of. I mean, I even have heard stories of people, with opioids. It's the same thing. You got to be careful where you get your drugs. Even marijuana. I mean, it's not frequent, but you hear it. You hear that fentanyl is in marijuana at times. So and it's
What are you hearing about that? I mean, is that normally the case of how, like, are there instances where people are getting,
oh sure.
marijuana?
I think if you don't know where you're getting your drugs and who's giving you drugs, I'd be really careful. It's like, and I know, you can get very desperate when you have this addiction. Okay.
how much trust can we put in into
Well, I don't know.
No.
I don't know if they're even thinking about trust. I think they're thinking about where's my next drug going to come from. And I think that that's really
I
important.
think one of the things Linda is referring to also, correct me if I'm wrong, is, people are purchasing things over the internet, and these are pressed pills. They're not even legitimate pills.
Yeah.
So they're pressed with,
We don't even know. Yeah, we don't even know what they're pressed with. And the other thing with the internet, unfortunately, there's so much misinformation online, and people don't even know where to start, when they're looking for help. So you have to really know where you could tap in and get the correct and professional resources. But yeah, you have to be really, really careful. I mean, I just want to share this story because this really affected me. There was a family that was vacationing down south, And I remember them hearing that they went into an Airbnb, and I think the child was 2, and she was walking around doing a thing, running around having fun, and she must have came in contact with fentanyl that was on the counter that was not cleaned, and she died.
Wow.
So, you hear stories like that, and then you hear a good friend of mine whose son, overdosed on pure fentanyl. It's really, it's out there. And I think the most important thing is know about it. Don't hide it. Be aware. That's what you want. You want to know what's out there and how is it affecting you. Even if it's not, like Patty said, your kid or it could be your neighbor's kid. It could be your nephew. It could be your niece. It could be anyone.
The other thing I did pretty early on when I realized there were pills, not just the marijuana, is I got trained in Narcan. Another story, but when I first got trained with Narcan, the administration was with a needle.
Right.
And now it's much easier. It's in the form of a nasal spray. I did have to use the Narcan, and so and my other son also used Narcan on a friend, and so it's an easy training to go through. It's a nice insurance policy to have inside the home, even for an elderly parent that might take too many of their pain pills for a surgery or something like that. Sometimes I know my sister had back surgery, and she was given some kind of, I think, like a fentanyl patch, and there was too much that got into her system that she was really starting to get loopy. And so one shot of that can really help reverse that.
So I trained for Narcan training. I did it at, we recently did the Pride Fest, and I can't tell you how many young kids came up and wanted Narcan kits.
Now, so you
Yeah, we did a training there, and then we gave it to them. So I think every house should have a Narcan kit.
Right. Can you just explain it, like what it does? I know Patty gave a little synopsis.
Yeah, so Narcan can actually save your life. It's a nasal spray.
Okay.
And then if you think the person has overdosed, okay, even if you don't think the person has overdosed, it will not hurt them if you use it.
Okay.
I just want to say that. But what you do is there's 2 in a kit. You take one of them out, and then you use it just like you would a nasal spray. And you lay the person on their back and hold their head up a little, and then put the spray in, okay? And you use all of it in one nostril. Yeah. Then what you need to do is turn that person into a recovery position, like almost a fetal position with their back away from you.
Wow.
Because potentially what could happen is they could wake up and be very irritable, okay, and violent. So, it's really important. The first thing you need to do is take safety for yourself. Put gloves on. That's in the kit.
Right.
Call 911. Very important to call 911 first, because while you're doing all of that, okay, they could be on their way and have backup. All right. So it's really, really important. And then if it doesn't work, then you can use it in the other nostril. So there would be 2. So
A lot of young kids feel, marijuana is harmless, but do you really believe that is a gateway drug to some of these other,
that's a really, really good question. It's legal, right? I don't know why they made it legal. That was one of the worst things they could do. But like everything,
instead stop going to be laced with fentanyl.
Yeah.
It's legal.
Right. And the other thing is, do I personally think it's a gateway? Yes. Okay. I personally do think it's a gateway. And I don't think it's factual, but I think more people I speak to also agrees with that. Just like vaping, okay? Vaping, I think, is a gateway to try other drugs.
And even alcohol, too.
Oh,
Gateway.
yeah. But it's funny. Alcohol and drugs are 2 very different drugs. You know what I mean? It's like, usually if you're drinking, not all, but most people, they won't, use drugs because they're getting high on alcohol. But there are a lot that will use both. I think it's what works for them.
Takes you down.
Right.
And
then the drug that'll take you up.
Take you up so that you're not, so that it'll wake you up in the morning or whatever. But
I think it depends on the person and what
Yeah.
they're into, you know.
but
I don't think there's one, way for anybody.
no, I just think if you're willing to try marijuana, you're willing to try anything else.
Right.
And so, and then once you try something, yeah.
Yeah.
I was gonna ask, it's a tough question, but I also I feel it's important. How has losing more changed, your life and maybe your perspective, whether it be about drugs, about how families interact or get help, or I know it's a tough question, but I feel like we grow and change on the journey, like we're all here for whatever amount of time, and we're here to have a mission or to learn something or to be hopeful. And what perspective, if any, change for you?
Well, clearly losing a child is, a devastating loss. Having said that, I can unapologetically say that I'm grateful that he's no longer in pain, because he was in a tremendous amount of pain. Not physical pain, mental, emotional, spiritual pain. And so the thing that I feared every single day when I went to my support groups or when I would wake up every morning is the thing that kind of brought me peace. And I hate to say that as a mother. I know some people would drastically disagree with me. But again, when you have a child that you love,
Right.
you will do anything to make them feel well.
Right.
And so the fact that he is no longer in pain brings me a lot of peace. It has taken away the anxiety I felt in my life every single day. Now that's a selfish thing to say, perhaps, but it also has made me look at other situations in a much different light. There are things that would have been catastrophic for me are no longer catastrophic. Like, I feel like I can get through I got through that, so I can get through most anything now. I remember one time shortly after Mark passed, being in a store, and mother and son were ahead of me, and the mother was, shushing the kid, time to be quiet, don't do that, stop asking me for this, stop it. And I said to her, be grateful that this is all that, I hated to do it. It was like I used the I just lost my sergeant. But it was like,
Need to hear that.
And to put things in perspective.
and I just, it was just like what I would have given for him to be tugging at me saying, Mommy, can I have a piece of gum? Right. Or whatever. I don't remember the exact details, but
back to those moments,
Right.
They go,
Innocence, just
right. And so I think I approach each day again with gratitude, because I feel like I don't know. He's no longer in pain.
right. I've heard that, what you're saying. I've actually, heard that about other parents having that once, even in other instances of sickness where they know the child is no longer.
And so I just want to say that I think Patty's amazing, because when you can take something, so painful and then turn it into positive with what she does, the work in the community and the school, that's amazing. And that's a power of example,
Right.
And that's what people look up to. It's like I come across a lot of people that have, survived, people that lost children. And, but when you can take that and turn it into a positive, that's really great.
Yeah.
So special person. Well, because a lot of people
could not do that.
The one thing I always want to do is to be able to speak to another person that's struggling with their loved one, because I remember that place. I remember that place, and I don't want anyone to feel like they're alone. Or I all the time tell parents or people that are struggling with a family member, to remember to take care of themselves as well, because you need to be strong in order to help that person.
Right.
And and Mark used to say it to me too, Mom, you need to work your program. I'm going to work mine. I'm glad you have a group, but you need to work your program. I'm going to work mine. And, I don't have any, I feel blessed because I don't have any regrets that he didn't think I loved him.
Right.
And I know he loved me. So we were able to, I can vividly remember in a jail cell, like I was talking across, like your typical thing. I was talking across through a glass window, and we said to each other, I know how much you love me.
So, and you said something earlier too, maybe before we started, that the drug problem doesn't discriminate; it transcends all.
Socioeconomic.
Does not discriminate at all. Yeah.
So it's important, and I guess even in seemingly wealthier communities, maybe the drugs are more prevalent, where access to the money is easier to get the drugs. I do, I feel like it is really important, because if you talk to teenagers, or my daughter's in college or whatever, they'll tell you what's going on, like in the colleges and different things. And you just try to encourage them to make good choices and right decisions. Yeah. And do you have any advice for parents that maybe are going through this right now, or having problems with their child related to that? Like,
Just to find a group of people that that you can be open and honest with and talk to. I'm a big therapy person.
Right.
The person that led our group was a licensed clinician, and she encouraged us to to take care of ourselves. So she actually even took us through the big book so that we understood what our loved ones were going through. And the big book is a book that's used in the 12-step programs. Now that's Alcoholics Anonymous, but the drug users follow the same program.
Yeah.
So yeah, I just my big thing is to find a community of people that that support and inspire you and encourage you to just go on.
And there's so many different pathways to recovery, which is really great. So people have options today, and I think that also with parents, it's like they want to try to find somebody that's professional, like Patty said, to speak with. I mean, education is important, awareness, and that's what we do.
I read a lot of books.
Yeah. So
Try to get
right, and we do workshops for parents, and we do events, and we try to our own podcast, which we have.
Right.
We'll have a topic related to substance misuse and mental health.
I've seen your podcast, and are they on a YouTube channel or your
Yeah.
Instagram?
No, so we have a teaser on Instagram that you could watch in case you want to, just see if it's for you. And then we have linked in the bio, the address for the YouTube address. So, which is really good. I want to mention, I think it's important that August 28th, September is Recovery Month. August 31st is International Overdose Awareness Month. But because of calendars and schedules, we need to do this on August 28th. So at 12 o'clock, we have a press conference in the village of Northport. And we're really really happy that the village, the mayor and the trustees have agreed to let us hang the flag for Recovery Month, and we raise it at noon. And then also at night, and this is what's really great, is that we do a candlelight vigil for people. Yes, for people that have lost somebody, for family, for friends. And we encourage people to join us and celebrate their life, and support the families. We have them bring pictures of them and put them on a board. We have speakers.
Just from that experience, I know we had talked about we don't have exact statistics per se on everything, but did you notice the trend in the East-Northport area of over the years of the increase of deaths of people in their 20s?
Well, I'm really happy to say that the numbers, I attribute it to a lot of the work that we're doing, are actually declining.
Declined.
Yes.
This was a time period I was here.
Yeah, 2016, between 2014, 16, there were some issues. And the overdoses might be declining. The vaping's off the charts in the middle schools with the kids. So, it's replacing, but again, prevention and education are so important. And that's really what we pride ourselves in doing, is trying to get the word out there. Just let people know what's around. We have such wonderful local resources. We have the Huntington Drug and Alcohol Counseling Center, which is really great. The Suffolk County Division of Mental Hygiene Services, they have a ton of programs that are good for parents, and then you have the Huntington Youth also,
Right.
which is great.
So utilize the resource.
I know you have, it's specifically drug and alcohol, but you do discuss mental health counseling as well. Like, do you, in your role as the executive director, like deal specifically with just mental health issues?
So,
Like maybe that could be part of a gateway to people
Yeah.
not feeling good about themselves.
So when you take a look at overall people with mental health issues, okay, I would say there's a good portion of them that use. So today when we address substance misuse, we also want to address their mental health.
Well, so we're going to be we don't have a lot of time left, but do you mind going to tell us about misuse, how we don't call somebody an alcoholic or an addict?
Well, I think so
Hear that.
I could say earlier, so I can call myself whatever I want. I can call myself an alcoholic. I can call myself an addict. I could say whatever. Okay. But if you call me that, I think that's really judging. And I think that adds to the stigma. And, you're not showing empathy. So I think changing the language is really important, because you want that person not to feel shamed, like we talked. They have a disease. They have a problem, and we want to help them.
Right. You don't want to be,
But we don't want to put them down doing it. Right. Exactly. If you have cancer, unfortunately, or diabetes, you have diabetes, you take insulin. Okay. That's fine. That's accepted. You're an addict. Okay. And people run away from you. They're afraid of you, for fear of what they might do.
Right. And same thing with mental illness. I
Right.
feel like there's still a stigma attached there, and people might not be getting the help that they need.
Oh, totally.
So we need to
shift.
judgment to empathy,
Right.
from punishment to support, and from silence to advocacy.
Exactly.
You
Which
have
is
to-
really
that
important.
shift, and that's what I feel like the Drug and Alcohol Task Force is trying to accomplish with the raising of awareness and just trying to make that shift so that people have more compassion.
Amazing.
Yeah, and I just want to, I guess, end or say that, what I want people to understand about prevention is it's not just about saying don't do drugs, okay? It's about creating strong, supportive communities, and it's about, where kids feel safe. You want them to feel safe. You want them to be heard, to be valued, let them know that they're important. These are all very important things. It means early education. We work with, the PTAs, to try to do early education, mental health support, and again, reducing the stigma so that families aren't afraid to talk about it.
Absolutely.
You know, I think talking is really, I always say we're only as sick as our secrets.
Communication is
Yeah.
huge.
Definitely.
Yeah, many levels, but
Right. Hmm.
yeah.
So it's important to build that foundation.
Well, thank you. It's been awesome having you ladies on. I really appreciate you telling your story, and
It's my pleasure. Any chance I get to speak about Mark, whether it's whether it's on this topic or any other, I welcome it because it just keeps him with me.
And if anybody's interested, we have meetings the third Wednesday of every month.
Okay, and any community member could go
Anybody can come.
at this.
Yeah, anybody who wants to come.
It's at the Brosman building.
We meet at the William J. Brosnan building at 7 o'clock, the third Wednesday of the month. So,
It's important to know.
and then
And I know you have the Instagram and
Facebook, Instagram, yeah, TikTok. We're on all of them.
oh, good. And we'd love to have you guys back. And we definitely the Greater East-Northport Civic. We're trying to build a following. So, to our audience, we just want to encourage people to share this important information and know that the Greater East-Northport Civic exists, and we've been in
So we're really happy that you exist, and we try to support it as much as we can as well. And I think that's what we need to do in our community is partner together.
Right. And there are other educational forums about different things that crop up. We plan to have that as well, and definitely to have you guys back with some different ways that maybe you're seeing like hope in the community, and
No, there's definitely hope.
Yeah, it's always else.
That's the one thing I carry with me because I have. The one last thing I'll say, being a member and a person that worked with the Herring Project, that community of people is not just the families that are struggling. They are helping the person that is struggling as well. And those people that are in recovery remain there, and they have a whole community of activities and events that they do to keep themselves connected and to live the life of their dreams that I never thought they'd be able to. And
Beyond your wildest dreams.
I am in awe of the people that each and every day they fight for their lives. Yeah, so God bless you. They fight for their lives each and every day, and it's a beautiful thing to witness.
Yeah.
thank you.
Well, thank you.
both.
Can I just throw out one thing? We have our movie in the park, August 14th. We're showing Minecraft. So it's a Thursday night, and it's a family kind of sober night where you can get together with your families, bring your blankets, bring friends. This is at Northport Harbor Park. So it starts at 7, and it's going to be a lot of fun.
Thing, alternative activities is what we need too. Instead of just hanging out, but we need alternatives for the students.
Right. But it's like, especially like you said, to not necessarily into sports, to have those other activities that it's busy.
Yeah, and have a family. I think it's so important for families to come together, whatever your family is, whoever your family is, could be extended families, It's important.
So anyway, thank you again. And also people can follow Greater East-Northport Civic on Instagram. If anybody has followers they want to share, or we're trying to build the community.
Great.
And we would should also like to build membership. We're going to have a meeting in July at the East-Northport Library. We're just working out some different vacation dates. And then we are also going to be at the upcoming events that are coming in the community, the festival. And
Great.
and things like that.
Wonderful.
We have a Facebook page as well, but we're still emerging and growing, and it takes a while to build awareness. And
Well, thank you both for the work that you're doing, because it's important. So thank you.
So we need everybody to tune in and listen to Voices from the Hamlet on Tuesday night at 7 p.m.
that would be August.
Next one is going to be August the 5th.
Great.
Okay.
Okay. Thank you. Thank you. Thank you.